So first of all, the data a year ago came as a surprise, but also as a pleasure to many cardiologists, diabetologists, endocrinologists, first of all. They appreciated that they have now an instrument, a drug in hands, where for the first time since a decade or 2 decades, the community had an intervention in hands to save lives. You can say there was a 38% risk reduction in cardiovascular death. There was a 32% risk reduction in all-cause mortality. Overall, the intervention, empagliflozin, an SGLT2 inhibitor, reduced cardiovascular death and mortality, and this we didn't see for so many years. The cardiologist appreciated the finding because the study showed positive results in a type 2 diabetic with cardiovascular disease. So this is most prominent for them. On the other hand, all the patients are in hands of diabetologists and general practitioners all over the place. And they, first of all, were looking after glucose control very intensively. And now shifting to cardiovascular outcome was took quite some time. 1 year later, I think everybody has appreciated the full data set, and we can apply this beneficial effect to the patient. The kidney is a major target organ in type 2 diabetics, and many patients go to dialysis after about 18 years of type 2 diabetes due to uncontrolled blood sugar. So the nephrologist now saw that the principle of the intervention, which comes from the kidney going to the heart, also saves the kidney and reduces the progression of kidney disease towards dialysis. And the main results, very prominent result, reduced kidney disease progression similar to cardiovascular outcomes by a very prominent 39% risk reduction. And if you go to more hard outcomes in the composite kidney outcome, a more hard outcome is doubling of serum creatinine, halvening of kidney function, or even dialysis. If you go to these hard endpoints, the main finding was that you could really save patients from dialysis by about 50% risk reduction, and the entire power of the intervention could be translated into 1 year of dialysis. You push patients and you push dialysis, and you can save patients' kidney function for 1 to 2 years with empagliflozin. This was the most prominent result, published about 6 weeks ago, and I think the kidney community now is taking up this, and they are also thankful that after 15 years without new intervention, we had the knowledge of blood pressure lowering and renin-angiotensin blockade before, but now after 15 years they have seen that a new powerful intervention can further delay progression of kidney disease, and I think this is so helpful for millions of patients out there with kidney disease moving towards the renal replacement therapy. If you understand that I'm a nephrologist, very interesting in diabetic kidney disease, and coming now for the 3rd time not for my lifetime, to such a huge diabetes meeting. Before I visited nephrology meetings, I see here now talking everybody about the new interventions saving lives. This was in the nephrology community, we discuss about saving kidneys, but this is the same thing, kidney death or kidney lives. Yeah? Here they talk about cardiovascular outcomes and controlling blood glucose. Yeah? So it's a different world. I understand, I like to understand, and this meeting is now, I think, full of major outcomes, not small surrogate outcomes, but looking at the big picture, saving cardiovascular outcome lives and hopefully also saving kidneys in the future.